Okay, so my prompt is your special education coordinator does not want you to offer speech and or language services to children unless their scores on language tests are at least two standard deviations below the mean in more than one area. Present your argument for a different way to look at scores and eligibility pertaining to one, speech sound disorders, and two, language disorders. Discuss assessment tools that you can use when determining eligibility for these types of services. You get to pick the child. You get to pick the age of the child. So kind of going off of this prompt, as a speech language pathologist, or soon to be speech language pathologist, I can see the special education coordinators want for consistency in determining eligibility. However, I respectfully disagree that children must score at least two standard deviations below the mean in more than one area in order to qualify for speech and or language services. This approach does not align with the best practices. It does not align with the IDEA requirements or the developmental needs of young children. So rather than relying solely on test scores, eligibility for speech and language services should be determined using a holistic approach. This means looking at the whole child rather than relying solely on standardized test scores. The holistic approach considers multiple data sources and the functional impact of the speech or language delay the child may have. This includes standardized testing, speech and language samples, observations, dynamic assessments, parent-teacher input, multidisciplinary team input, and the overall functional impact on the child's social interactions, behavior, and learning. So, in this case, I chose a 5-year-old child. So let's say that a 5-year-old scores 1.5 standard deviations below the mean on expressive language, but they have difficulty forming complete sentences. They struggle to tell stories. They're often misunderstood, and they become frustrated in class. Well, if I were to follow this strict cutoff, um, where the child needs to score at least two standard deviations below the mean, this child would not qualify for services. However, when following a holistic approach, the team would consider more than just the two standard deviations below the mean. The holistic approach would consider a language sample analysis, classroom teacher's concern, um, parent report, um, dynamic assessments, showing maybe limited responses to strategies, and together, using all of these data points, this would show a functional need, and the child would likely qualify for services even if they're not two standard deviations below the mean. When specifically talking about speech sound disorders, um, standardized tests may not capture functional impairments in young children. So again, that child may score 1.5 standard deviations below the mean, yet be completely unintelligible to unfamiliar listeners. So articulation and phonology assessments, they often do not reflect the impact on social communication, academics, or participation in the classroom when these are key eligibility factors under IDEA. Let's say that 5-year-old child who is 60% intelligible to unfamiliar listeners when the expected norm is to be 90 to 100% intelligible, they may not meet the two standard deviation cutoff, but they clearly need those services. Some assessments for speech sound disorders that could be used would be the Goldman-Fristow test of articulation. This can identify sound errors and developmental patterns, a speech sample, parent-teacher questionnaire, observations. This could be in the classroom, in the lunchroom, on the playground, as well as input from other team members if this child is receiving other services. When focusing on language disorders, the two standard deviation cutoff could be problematic because language includes vocabulary, syntax, morphology, comprehension, and use. So children may demonstrate significant impairment in one or more of these areas, but they may not necessarily fall below the two standard deviation in multiple areas. So at age 5, language development is critical for literacy and academic readiness. So even, mild to moderate language delays can really impact their kindergarten success and long-term academic outcomes. Again, the IDEA allows for identification based on educational impacts, not just these standardized test scores. So, with language disorders, some assessments that could be used would be I could use the PLS-5, a language sample, dynamic assessments such as fast mapping or narrative assessments, parent-teacher questionnaire and checklist, informal observations, again, in the classroom, on the playground, at home, in the lunchroom, as well as team member inputs if this child is receiving other services. So the IDEA emphasizes how a child's emphasizes the overall child's educational performance, not just the test score. So we must look at the whole child and consider how their communication skills are affecting their learning, as well as their interaction with their peers and development of their age-appropriate skills. So in conclusion, while standardized tests are important, they should be interpreted alongside other sources of data. So again, kind of talking about those informal observations and dynamic assessments, language samples, speech samples, team member input, parent input, questionnaire checklist, all of those things need to be considered. A child may not be 2 standard deviations below the mean, but they still may qualify under the IDEA if their speech or language disorder is affecting their educational performance. As speech language pathologists, it's our ethical and professional duty to advocate for services when a child clearly needs them, regardless of just their standardized cutoff scores.